everyone. On behalf of Voice of Healthcare, I'd like to extend a warm welcome to all the speakers who have joined in for this panel discussion and also to the audience who have joined for this session. Today, we mark the second episode of the National Virtual Forum Asthma Awareness, which has been conceptualized in collaboration with AstraZeneca to mark the World Asthma Awareness Month, that is May 2022. The topic for today's forum in this panel discussion is Closing the Gap, Connecting Across Healthcare for Providing Quality Care Affordably. And to talk about it, we have leading experts from the industry who will be shortly sharing their views around it, whom I'd just like to go ahead and introduce. Before we start the panel today, we have our keynote address by Dr. Ratan Kelkar, who is an IAS officer and mission director at National Health Mission, Government of Kerala. Then up we have Dr. Deepak Talwar. He is the senior consultant and chairman, pulmonology and sleep medicine at Metro Hospitals and Heart Institute, Noida. Welcome to you, sir. We have Mr. Uttara Kumar, director market access at AstraZeneca. Welcome, Mr. Kumar. We have Rajiv Khurana, founder and trustee, Healthcare Education. Welcome, Mr. Khurana.
Thank you.
We have Dr. K.S. Satish, sir is the consultant pulmonology at Manipal Hospital, Millers Road, Bangalore. Welcome, sir.
Thank you. Thank you.
We have Dr. Sheetal Chaurasia with us. She is consultant pulmonary medicine at Manipal Hospital, Whitefield.
Thank you.
Along with sharing her expert views, Dr. Sheetal will also be leading this conversation with the question and answers round. So without any further ado, over to you, Dr. Sheetal.
Hi, I'm Dr. Deepak Talwar, consulting pulmonologist in Manipal Hospital, Whitefield. Thank you. So I would request Dr. Deepak Talwar to open the discussion with his inputs on the common challenges in the management of asthma, both from patient as well as a doctor's perspective.
Thank you, Sheetal, and good evening, everyone. I'll be just sharing 2 slides, I think, to set the ball rolling for what we are going to talk about today. I think the most important aspect which is there is that, so I think it's being run from the other side. So can we move on to the first slide? Yeah. So asthma in 90% of cases is very easy to treat, and there is no reason that anyone should die of asthma. However, the death in asthma is estimated to be 2 lakhs per annum across the world, and it is seen in all the countries, even well-developed countries. Of course, we don't have exact figures for India, but we have figures that we have about 20 million asthmatics in India. And about, even if we go by something like 2% of them are severely uncontrolled asthmatics, we will have a huge number of these patients who continue to suffer despite the treatment being available to them. We have very effective treatments to control asthma, and that's why I said in 90% of the people, it's no problem at all. The problem is created in this not even 10%, but less than 10% of them, where these patients actually get admitted into the hospitals because of their recurrent exacerbations. They need to get admitted into hospital for an average about 5 to 7 days. They come almost about 3 to 4 times or 5 times in the hospital every year. They require to be treated with an intensive medication. Some of them get into the intensive care unit where they have a life-threatening asthma. And on the top of it, if we look at the financial aspect of it, what we will find is that whatever is the government expenditure as well as the personal expenditure out of pocket from the patients, almost 90% of it is being taken care by this group of patients only. So the 90% of the patients don't get this kind of, the healthcare cost, which is being primarily driven towards taking care of this group of patients, which is called severe asthma. These patients are really very, very at the end of the road of this asthma journey, where they continue to suffer. They have poor lung functions. They have a inability to do their daily activities. They get sudden attacks. They get suddenly into the hospital or emergency rooms. They have to take these medicines, which we all know are definitely going to cause long-term harm to them. And for them, the options available are always very, very limited, because these group of patients are on usual medications, which are inhalers, but uh, continue to suffer. Can I have my next slide, please? Yeah. This slide is further trying to tell us that almost 30% of these patients get admitted into the hospital on an average 2 times a year and spend 7 days in the hospital. And this kind of worsenings can be because of exposure to pollution, allergens, viral infections, and may be associated with fever and viral respiratory tract infections. But this is the kind of situation which, whether the patient gets into a government hospital, government sector, or gets into a private sector, somebody's paying for that. If it goes from the government, then obviously a large chunk of money which could have been diverted to take care of the program and giving the medications to 90% of the population of asthma gets diverted towards taking care of these patients. If it gets into the private care, then this patient either pays through his pocket, or it is the insurance companies which are paying it. And that is driving these patients absolutely to the brink, where they have no longer any money to take care of themselves, and they get easy cure of, rather the easy way out, which is like taking oral corticosteroids and loads of them at home, which leads to serious toxicity and side effects in this group of patients. Last slide, please. Yeah. So this is the slide which very nicely highlighting the fact that the oral corticosteroids, even if they are used for 5 days in 5 times or 4 times to 5 times in a year, even if it's not on an oral maintenance dose, where certain people would like to like not spend medicines, not spend much money on the medicines, would like to take just 5 to 10 milligram of prednisolone daily to keep their asthma under control, they are at the risk of very significant diseases like diabetes mellitus, development of cataracts, severe osteoporosis, thinning of skin, easy bruisability, and bleeding into the skin. And all these side effects, as the steroids increase in their dose, they keep on multiplying in their risk factors and odds ratio of developing these complications. These complications ultimately on long term can affect the kidney as well as other organs of the body, which is really harmful and leading to end stage diseases, where patient doesn't suffer from asthma but suffer from all other diseases which has been precipitated by this, like diabetes, hypertension, and all these affecting the kidneys. So considering this, that part of asthmatic patients who are basically not only the sufferers for themselves but also cause very significant burden to the healthcare providers, whether they are in the government or in the private setup. So I think looking at them is the most important aspect. And what we find is that nearly 50% of these patients are actually eosinophilic asthma. And that is why they respond beautifully to steroids, get hooked to steroids because they are pretty cheap, without knowing that the ultimate detrimental side effects which are going to come on a long term and won't be reversible even. These kind of asthmatic patients, which are called eosinophilic asthmatic patients, do have options now of using the therapies. In the West, oral corticosteroids have been sent to the last possible choice. And before that, there are therapies which are considered as the personalized therapies or targeted therapies, which are being offered to them in the form of biologicals. And one of the biologicals, or the two of the biologicals available in India, are also for this group of patients, which have actually revolutionized the treatment of these patients. Only thing is the expenses and who's going to bear the expenses. But very importantly, what we need to look into is that what is the cost of admissions to the hospital vis-a-vis the cost of the therapy. And at the end of the day, we should not forget the quality of life, improvement in their health related risk, which happens with these dangerous therapies which they are using at the moment. I think with that, I would like to close this here and leave it to the discussion by the rest of the people.
Thank you very much, sir. I think that was you actually put the fingers on the pulse. Dr. Talwar, what are the opportunities for healthcare organizations to collaborate with other healthcare institutes to improve overall care of asthma patients?
I think wonderful question, Sheetal. Very nice question you have asked. Thank you for asking me, because taking care of severe asthma patient takes a village. So you have more the help you need, and you need the help at different levels actually. You can provide as a medical person the care, but you require so much of extra things like follow up of these patients, education of these patients, understanding of their problems, following up them from homes, looking at their social factors, looking at their families. I think there are so many things which requires to be taken care of by various healthcare organizations. And what is also very important is, see, our care in India is a fragmented care. We don't have a well systematic care like we have in the developed countries, like in the Western world, where you are channeled through a proper program, and the program has a very strict follow ups, the guidelines, as well as the action points and follow ups of them. So all these kind of things are something which really need to be worked upon for these kind of patients, because the moment you slip, they slip, then obviously the whole vicious cycle starts back again. So the compliance, as well as looking after the various aspects which may be not very revealing to the physicians, or maybe the physicians may not have time to get into the great depth of that. We need a lot of other healthcare organizations to work up in a close association with the doctors to improve. I think the way Rajiv has spoken about the studies in India. So this is kind of a thing, even everywhere, not even in children. I think everywhere, even if you talk to adults, they are taking inhalers, but if you ask them, have you asthma? They say, no, we don't have asthma. The thing is, the education has to be brought in from the basics, that we should not shun the diagnosis of asthma. It's a disease which you have no right to die with. This disease, you have no right to suffer. You can easily be treated. But the problem is that if you are trying to go and beat behind the bush by not accepting the diagnosis, by thinking that this is a diagnosis means a kind of a stigma, then obviously the things go in a wrong manner. I think a lot of work needs to be done at the society level. Lots and lots of it. One such program, you are doing it right now, Sheetal.
Totally agree, sir. Especially with asthma patients, just by the hearing that they are on steroid inhaler, they just don't want to take it. So, Mr. Khurana, since we are talking about all biologics and targeted therapies, and they are all expensive. So, what possible intervention can be there from the central and state government, and what should be the role of corporate and NGOs to make these things more accessible to the population that needs it? It's a very small percentage of patients who would need this treatment, but how to make it accessible to them?
Again, a very wonderful question, Dr. Sheetal. Thank you very much for asking this. And let us not consider the number if it is small, because those who suffer, for them, life depends on it. And I go with Dr. Deepak Talwar when he says nobody has a right to die because of asthma. And even if, when he says there are 20 lakh people suffering by asthma in India, 20 lakh is also a huge number. Now, the question is, when we are talking about the government, when we are talking about the corporate world, when we are talking about other people, do we consider this as a higher priority because the numbers elsewhere are higher? But then, when a person suffers from asthma, it is an absolute high level of emergency. So when any disease which you meet with an emergency, it should be taken up a high priority itself. Therefore, synergizing the actions of multiple stakeholders is very, very vital. Now, who are the stakeholders here? Of course, the government, the hospitals, the private hospitals, the pharma companies, but much more than that is also the patient and the care providers of the patient. And when we say asthma is more prevalent amongst the children, then how are the schools and colleges taking care of it? How at the very first instant things are taken care of, because many lives have been lost in school only because the teacher didn't know how to handle the situation. The response was, maybe this guy is telling a lie. Okay, send him to the medical room or call the parents. And by the time the parents come, by the time the treatment is started, a lot of time is lost, and in certain cases even the life has been lost. So we need to understand all this dimension. So the question is, how do we educate people right at the spot when this thing is happening? We made an effort. Lung Care Foundation has created an asthma manual for schools. This has been translated in 11 Indian languages. All these copies are freely available on our website. Through the Ministry of Environment, 1 lakh copies were sent to schools through PDF. Now, PDF is a joke because PDF is attached to an email and then more emails come and then the PDF goes down somewhere. So, what we need to do is actually print more of these copies with complete manual, which is self explanatory, pictorial, etc. And then make sure that it is not only kept in the school, but also the teaching and non teaching staff of the school are trained. This World Asthma Day on the 3rd, we trained 350 teachers of a school online. So far, we have trained roughly around 10,000 teachers across India, but that number is minuscule. We need to train people, and much more than that, we need to train the trainers first who can go and train organizations as well as teachers in the school to 1 or 2 hours of program. Let it be a certificate program also, so that they can have a certificate and learn all these dimensions themselves. So once we have that, and then we have an asthma management policy well drafted within the school itself, and a good collaboration is entered into between the school and the parents, because the parents must tell the student that here is the kit in his bag. In case there is an emergency, what should be done? Who could be the buddy who could immediately understand the emergency of his friend and actually raise an alarm to provide the service to his friend? Let me assure you, this really works very well. Even in my family's case, my son was a buddy for his friend, and in many of the attacks, he saved the life. And the mother of that friend ensured that they always remained in the same section for 12 years so that the asthma emergency could be handled, because an immediate alert could be created. So when you have such kind of buddies, let me tell you, precious life does get saved. I agree with Dr. Deepak Talwar. 90% of the cases, the treatment is minuscule. But why do we let that 90% cases turn into more of emergencies? We need to avoid that immediately. And that is where a collaboration is important. And the frequently asked questions, whether in the video form or the text form, etc., should be available to all the stakeholders so that all these emergencies could be handled, and not just English, please. We need to actually discard English and get into all the Indian languages so that people understand that. And one more thing, we have to collectively work on the root causes which trigger these asthma, the air pollutants in the classroom or at home. And in case we are not focusing on the primary problem of aggravators of asthma, then just treating asthma itself is not going to be a solution. So therefore, we need to have a very large framework in terms of ensuring that there is a clean air all around us. I hope this answers your query, Dr. Sheetal.
That's a wonderful point, sir, and a wonderful initiative. I just hope that it reaches every nook and corner of our country. So, Dr. Talwar, with
We
your
just need more funds to print it. It's as simple as that.
So, Dr. Talwar, with your vast experience in the field of pulmonology, what do you feel are the unmet needs or expectations of patients and doctors from the government institute? I think it goes from the previous question. So,
I think the most important aspect which I discuss with the patients is that the affordability of the medication. So when we discuss about the affordability, they do expect that there should be a backup plan and it should not ruin their economy and bring them into economic crisis. Now I'll give you just one small example. See, you talk about like in our specialty we have lung cancer. Okay, we have so many cancers we know. The moment anybody is diagnosed with a cancer and he doesn't have a money for the treatment, there is lot of efforts from the society to help that patient to get the treatment. What that treatment might offer is just a couple of weeks more of a good quality life, right? Here there is a question of a long life for the person, and it is like a it's like a total change. Actually, we are not giving him couple of weeks or couple of days. We are just making him normal and live normal life for the rest of his life. So here we don't ask for help, we don't ask, and neither I am finding any kind of the societies, any kind of foundations coming up and helping them out. So their entire expectations is on the government setups and the government systems. And government systems, obviously, I can very well understand if they are able to buy that kind of a medication for 10 patients, in that they can perhaps treat maybe 1 lakh patients with that same amount of the medicine. So obviously there will be a different kind of thinking from the government process, I can very well understand. But what about the rest of the people? What about the rest of the corporate, what we say, corporate social responsibility? What about the other places where we can look forward to some kind of a help for them? I am sure that if we ask the pharma companies once in a while, once or twice in a way, they do come up with a help to us that okay, we'll provide free. But obviously, it cannot be provided free to everyone, basically. So we do need this kind of a healthcare system where we can provide it. Look at all the country. Even I am shocked to see that even the countries which are not so well developed, even they are providing such kind of a care to their patients. So I do not know how they are able to justify and afford it, but it is possible they are getting it. So it's Southeast Asian countries which are doing it. So I think there has to be a point made that this is not, because everybody thinks asthma is like nothing, it doesn't need any treatment, so it's a simple treatment, nothing is required for them. Nobody talks about these poor patients who continue to suffer despite taking the medication. I think they need a separate attention, they need a separate kind of a thinking, and they definitely need a help from whichever sources are available to them. Thank you.
Excellent point, sir. Um, since Dr. Talwar pointed out about the pharma companies which help some of these patients, so what are the opportunities for pharma companies to collaborate with other healthcare institutions to improve overall care of asthma patient, Mr. Kumar?
Thanks, Dr. Sheetal. Actually, l- most of the speakers before me have spoken a lot about the burden of asthma. Maybe I just want to reiterate a couple of points on that one. One is that while the number of deaths for asthma in India might be lower than several other diseases, leading it to be not getting that level of importance, but as per WHO, India has the highest number of asthma deaths in the world, contributing to 22% of the global death burden. Right, so we have a significant burden. Uh, Another thing which already Mr. Kunana talked about in his study, right, which also we noticed in another study is that 75% of asthma patients have never undertaken a lung function test, and it's a very simple test, low cost, right? Uh, but those patients with asthma get at least 3 to 10 asthma exacerbations, some of which require hospitalization, right? So there's a significant burden on the patient as well as the health system because you're using hospitals, which can be avoided if you're diagnosing and treating appropriately, right? So that is a significant burden on patient, on the patient's family, on the society and the health system, and even the economy because when in a case of exacerbation, the patient is missing school, missing work, there's loss of productivity, right? Now, to address this and burden and alleviate this, we'll need wide-ranging partnerships, right? Between pharma companies, between HCPs, between hospitals, health system, public health systems, and more importantly, patient groups, right? Now, some of the ways we can look at it is one is we need to first get a protocol or a national asthma program up and running. If that can be a national TV program, or can we also have a national asthma management program, right? Because first of all, asthma incidence is increasing. As Mr. Rajiv talked about, air pollution is increasing. AQI year on year is becoming worse in the country, which means that we are going to have increased burden of asthma going forward, right? So even if you're not able to control, then we are at least manage it appropriately, right? And management is not very difficult, right? It's basic tools, something our public health system can do, right? And even a private can also easily manage, right? So setting up, and the second area is around use of technologies, right? So we have, I talked about with you earlier that we have identified a couple of technologies, low cost interventions, which can help in diagnosing faster, better, easier, right? How can we leverage those technologies? And third, even within technologies, can we, how do we segregate which therapies to be used in which space? Because some 90% patients can be managed very easily, 10% with difficult. How do you segregate patients? So having those protocols all in place. And the second area, something that we, where we have already done some work, is we had set up piloted two center of excellence within the public health system, where we improved their ability to manage asthma patients, right? Now there might be some publications of what's been the impact of these center of excellence, and once that's done, maybe we are looking at working with public health systems to scale this up in a sustainable manner, working with other healthcare system stakeholders. So these are some of the areas in which we are looking at of how we can work with the healthcare system to build up partnerships to alleviate the asthma burden.
Thank you, Mr. Kumar. So, Mr. Khurana, you already discussed some of the unconventional ways to manage asthma at a community level. As per you, moving forward, what should be the direction of asthma care? What all is expected from a public health sector other than adopting a regulatory note from economic point of view?
Sure. Thank you very much. I'll again go back to my initial comment that now there is a medical dimension and there is a management dimension in terms of managing all these things. And I'm a management professional. So I look at it from two perspectives. One is the macro perspective and another is the micro perspective. So when we look at the macro perspective, we need to actually focus on five dimensions to begin with. One, the strategy. Now, when Uttara is talking about the National Asthma Management Program, this is an integral part of the strategy itself. But then, are we generating enough thoughts? Do we have a clarity? Do we have a commitment towards that strategy? Do we, with all the domains of medical science, do we have the same thing? Whether we are not even talking about Ayush, here is allopathy and Ayush. What kind of a combination could happen? We need to think about all those. That's the strategy part of it. Second is the systems. What kind of processes do we put into place? Third, do we have the right spirit also? Are we motivated enough to actually attack it in a more proactive manner, and therefore club the emotional angle of how the patient suffers with the rationality of managing the issues? And the fourth dimension is, many a times we pick up the low hanging fruits and they say, oh, the whole thing is solved. So those success traps we need to be really very careful about. And finally, we also need to focus on success celebrations. If we achieve milestones, we must celebrate, we must propagate, we must make people champions. Only then we will enthuse more and more people in terms of solution. This is so far as the macro aspect is concerned. But when we talk about the micro aspect in terms of the patient level, I think we need to focus on four dimensions very strongly. Number one, everyone must learn more, because it is our ignorance which is aggravating the problem. Second, we need to care diligently. Whatever the doctor says, prescribes, we should, just don't leave it in between. It is like a postage stamp. You put it on an envelope. The purpose of the stamp is to make sure that the envelope reaches from one place to another. So if the doctor says this is something that you need to do, the patient and all the care providers have to ensure that it is done diligently. Number three, we need to be consistent in terms of our approach, because all these solutions could be not one way. Once you go to the doctor and everything is going to be over. And fourth, you need to become a coach to others in your society, so that you share your experiences, tell them how the consistency and diligence is important in order to treat asthma. And if all these actions are not done at a micro level, then we will create much more aggravating situation for our children. Dr. Sheetal.
Thank you, sir. So, Mr. Khurana touched upon the emotional part of the asthma. So, Dr. Satish, you have been a stalwart in the field of pulmonology. What do you feel are the fears and anxieties of a patient who is diagnosed as asthmatic? And what, as a treating physician, you do or somebody, youngsters can do to allay those fears?
Okay, thank you, Dr. Sheetal. That was an excellent question, and which is an important question. There is no shortcut in managing asthma, and we have to spend time as a pulmonologist or any doctors for that matter, and we have to find the right term for the disease, not say you have wheezing, you have eosinophilia, you have bronchitis, you have allergy, and you have phlegm in the chest, you have congestion in the chest. And as Deepak mentioned, and you also mentioned in your introduction, that asthma is underdiagnosed. The word asthma itself is a stigma, is scary for patients, probably because of 50 years ago, the asthma did not have treatment. Nobody knew the science part of asthma. Nobody really knew the treatment, and the treatment were all not cost effective, caused side effects, and patients continued to suffer. So, first thing is to diagnose as asthma. And as you said, underdiagnosis leads to undertreatment naturally. So, in India, the oral bronchodilators are the preferred way of treatment, and we have to allay that fear that why oral bronchodilators, time and again, the various asthma societies, including GINA, including our own guidelines on asthma, Indian Chest Society, have mentioned no role for oral bronchodilators. And we have to allay the fears that, and as Mr. Kurana was mentioning, celebration, which means those who have had asthma, like celebrities, they always identify the diseases with celebrities, or somebody who's done so well in the society. For example, filmy people or sports people, and tell them that, look, they have achieved so much. In my state, in Karnataka, in Bangalore, the Olympic swimmer is one who was my patient for many years. And since he came out and said so, I easily identify and tell people, look, this is what he has achieved. As a child, he had asthma, and now he participated in the Olympics. Or, for example, achieving in various other fields, and saying that asthma patients should not suffer, as Deepak said, and they have no right to die of asthma. Asthma deaths are not uncommon in the world, and especially in India. India has become the capital of asthma deaths, which is very sad that such a simple, treatable, and preventable disease like asthma deaths, we are not doing much in that field, and we have to go on various platform and tell patients that, look, asthma is treatable even though it's not curable. You can live a normal life and achieve whatever dreams you have, and by talking to the patient, counseling the family, as Kurana mentioned about in the school, for example, and getting buddies to help them, teachers to get involved, stakeholders, politicians, you name it. But it hasn't happened, and we have a long way to go. But I think we have to make really good progress in this aspect to treat asthma, and take away the myths, take away the misbeliefs, and take away the stigma attached to asthma. Thank you, Sheetal.
Thank you, sir. So, coming back to the new therapies, the targeted therapies. So, Dr. Talwar, as a senior pulmonologist, what is your take on the upcoming novel therapies? I mean, in a real, real world scenario, who are they helping people? Whom you are advising, who are taking just uh, just your views on this?
So, Dr. Sheetal, the important aspect is the new therapies are expensive. There is no doubt about it. They are biological therapies. They take time. They are expensive. The issue is primarily that who deserves it. So I think the identification of the right candidate is the most important thing in choosing these therapies, because these are targeted therapies. They will act only on certain aspects of the patient's suffering, like if they are getting hospitalized, if they are getting exacerbations, if they are taking steroids. So these are the three main, the points which are the, actually I call them the touch points in the life, because they are going to change their lives. So if you are able to reduce that, if you are able to bring them to zero, then something you are going to do for them which is going to be, I think, beneficial for not only them but their entire family and ultimately to the society. Now, to identify that patient, you have a very rigorous course to be followed for these patients. They have to undergo various tests. They have to undergo various difficult to control factors which need to be looked into. And it's a process which takes nearly about 3 months before we come to the level where we use these drugs. In a real world, it might be different, because the patient can come and say, okay, I can afford it, give me this therapy. But that doesn't matter, because they think by taking this once a month injection, they will not be requiring any treatment at all in the rest of the life. That's not going to happen. So I think the putting the facts together to the patient is the most important aspect. Having open discussion, the decision making is mutual between the patient and the physician, and the expectations have to be real. So if that kind of a situation is concerned, you will find that there will be so much of gratifying relief in these patients, that they will always be like, indebted that they have been able to get into a medication therapy where the life has completely changed. It's absolutely 360-degree change. But if we choose these patients inappropriately, in a hurried manner, that is not going to happen. So that's why I think what Kumar from AstraZeneca was trying to point out, that's the job of the precision clinic. One patient is going to take 2 hours. If you have that much of a time, you have a right to give a medicine which costs so expensive, which is so expensive. But if you routinely shed those kind of prescriptions, they won't do any good at all, because neither the patient will understand that what is required, how is it required, what is its, everything needs on counseling, and counseling requires a lot of time for these patients, because they have never been spoken about it, they have never got any idea of what's happening to them. So I think in real world, the effectiveness is beyond what we see in clinical research. So this is a usual observation across the world. You look at the data from Germany, you look at the data from South Africa, you look at the data from US. What it shows is that if a drug is effective up to the level of 60% in the clinical research, it shows 90% improvement in the real world. The reason being that we have those patients who are actually suffering much more. So obviously they will respond much more. But also, these are the group of people who will really understand, because they are not getting medicines free of cost, they are paying from their pocket, so they will be looking for each and every aspect of the medicine as well as its effects before taking a call that they are going for that therapy. So I think that makes a lot of difference. But I think at the end of the road, I would say that it is a dedicated clinic which is required to run these kind of treatments to them, even for that matter bronchial thermoplasty. So like now the bronchial thermoplasty is being used very infrequently at our center, because we are finding more gratifying response with the biologicals in this patient. So we are happy with offering them whatever is the best suitable to them. Targeted therapy or a precision medicine means that for an individual patient, this is the best, and you need to decide that with a lot of caution, with a lot of knowledge, and of course you need to put in a lot of best efforts there. Thank you, Sheetal. Thank you very much.
Very, very, very important point, sir, what you said. And I'm sure with this note, a lot of people will take into account before prescribing any of the targeted therapy. So, in the end, Mr. Khurana, I think I'm coming back to the similar question. What initiatives have been taken by the Lung Care Foundation to bridge the gap? You told us many of the initiatives. If anything is left, you can
Sure.
add.
Dr. Sheetal, thank you so much. We focus on three things: awareness creation, clinical care, and the think tank. So we carry out a lot of research. So we have a program called DFCA, Doctors for Clean Air and Climate Action. And we have around 21 medical associations working along with us across India. And these other people become our strength in terms of communicating further. And we do, whenever we do programs on asthma care, we actually draw on the resources of these doctors spread all across. So we have covered thousands of people, especially in schools, in terms of educating teachers, etc. And we have done the physical programs, we have done online programs, and these are continuing. Our attack has been mainly on against air pollution. So we are focusing on clean air, because if at the base level, if we can correct the things, most of the problems can be solved. So therefore, our tagline is Mera Pran Hate Vayu Pradushan, my commitment that we remove air pollution. So how do we mobilize the strength of people all around? Especially in Delhi NCR, we have a program called SHAN, SHAN, Saaf Hawa or Nagrik, where we have actually channelized the energy of common citizen in terms of how do we work in their surroundings to actually solve the problems of air pollution. And a similar work with we are doing with the corporate world through various multiple association, and I've done it in approximately 15 cities of India, is back to ABC, actions for better, cleaner air. You focus on cleaning the air, and a lot of your problems do get solved. And those who suffer, we have a program called HELP, healthcare expenses for lung patient. We seek donations. So whenever the patients come to us, whether it is the COPD issues or peculiar asthma problem or lung cancer, we mobilize funds and actually help in treating them. And at the moment, even the governments have also started working along with us. We have a letter of intent from the Uttar Pradesh government. We started working with Haryana, and I'm sure in times to come, lot many other states would also join in. I can go on and on to talk about Lung Care Foundation for hours, but I understand there is a time constraint. So therefore, I'm just limiting myself to this, please. And this has been our journey only in the last 7 years. Thank you so much.
Thank you very much, sir. So with this, I think we come to the end of our discussion. And for me, I think the takeaway message would be uh, uh, the backbone of asthma care remains the basics, the inhalers, the patient education, the awareness, and the counseling. And the newer advances for the targeted few people, and it can change their lives 360 degree, as Dr. Talwar said. So I would like our esteemed speakers to give their closing comments. Dr. Satish.
Okay, thank you so much. And it was a nice discussion, and especially to know from Rajiv Khurana what they are doing. And I'm very happy to support such a program. And
Sir, lead the way. We'll be happy to assist you wherever you are doing that. Please, that's our promise to you.
Thank you so much. Yes, I mean,
we need leaders like you. We will be there behind you in terms of carrying out all these things. Because I believe besides the medical aspects, the management aspect is very important. So I promise you all that support.
Thank you. Thank you. And I think, Sheetal, main thing is to diagnose, as we all discussed, underdiagnosis of asthma. And then once we diagnose asthma, and then to treat them appropriately with simple controller medication in the form of inhalers. And then prevention, of course, is very important. Air pollution, as we mentioned, house dust mite, smoke, and biomass fuel, and so on. And then to prevent asthma deaths, we need to take this on a war footing and treat asthma aggressively, and also to give away the message that asthma is treatable. And as Deepak rightly mentioned, no way an asthma patient has a right to die. And that is what is my closing message. Thank you.
Dr. Talwar. I think we lost Dr. Talwar. Mr. Utra, what would be your closing message?
So we have the technologies and the resources needed to effectively diagnose, treat, and manage asthma. What is needed is to bring up the voice of the need to improve asthma management and the focus on asthma by the health system, and for which we'll need a multi stakeholder partnership to help bring that attention to it.
Mr. Khurana.
Yeah. Thank you so much, Dr. Sheetal. while listening to all of you, I created a, 6-step approach, and I'm very fond of writing acronyms. So I've just created an acronym on the word asthma itself. So allow me to speak on that. I'm an international management consultant and trainer and a writer. So therefore, these things come a little naturally to me. So let's look at it. A of asthma. We need to have acceptance of the problem and create more awareness about this. So acceptance and awareness. Then is S. We need to synchronize all the stakeholders, because unless and until people won't work in a synchronized fashion, things are not going to be working, or they will all work in different directions. T. Take charge proactively. So far, we have been only reactive by nature. And this is what the newer technologies, the newer thoughts will actually give us a lot of impetus and support. H. Harmonize asthma related training in schools. We call it ART, A-R-T, asthma response training. So that when we take this and we train people on this, this is our art. So that art of actually ensuring that children live happily. Then M, mitigate and measure the impact. And when we measure the impact and mitigate, we should also continue doing our research. And finally, A, accelerate action. The challenge is so huge and humongous that every year we need not repeat what we have done in the past. We have to geometrically keep breaking our own record, and that should be the breathtaking speed with which we should be working. This is the way I look at it, a 6-step approach of an acronym on asthma itself. Thank you.
That was very
Excellent.
poetic,
Thank
sir.
you so much.
I think that kind
Thank
of
you.
sums up the entire discussion. With this, I'll hand over to the organizers. I'll thank them for organizing such a event and calling all the stakeholders here. Thank you.